It is now 2021. Who would have thought nearly 12 months later we'd still be in the COVID-19 pandemic and lives still being affected? My name is Maureen Lewis and I'm the Chief Officer of a local organisation called Walsall Black Sisters Collective. We are a registered charity that's been delivering services in the community for nearly 35 years. Back in March 2020, when the pandemic first hit England, and we had the announcement from the Prime Minister Boris Johnson that the whole country was required to go in lockdown, we as an organisation did not know what we was going to do. It was something out of the blue, and for us, we didn't know where our next penny was going to come from. We had to close down a number of our services that generated income into the organisation. All we had left was a small pot of money. But our priority wasn't the finance during the pandemic, although it was quite worrying for the organisation. Our priority was basically supporting the vulnerable and those who were at risk in our community. Many of our service users were vulnerable, they were elderly, they didn't have family, they didn't have friends. So for us as an organisation, we had to respond to the need. So we developed a number of services, which you'll hear about within this video. Services that ensured that people remained safe and well, and that risk was reduced. I'm not going to do all the talking today. However, I'm going to let my staff, my volunteers, our partners share about the work that we have been doing here in Walsall.
Our COVID survival project has been a great success in our community and has benefited around 330 people and delivered approximately 2,700 sessions. We have helped people cope in these difficult times of lockdown, job loss, poverty, mental health, social isolation and loneliness. We have provided food shopping and food parcels to approximately 172 vulnerable people in our community. And as you can see, we are in the room where all the food is stored, and we ensure that these people are given food every single week to maintain their health and well-being for themselves and their family while they are recovering and shielding in their homes. Telephone befriending calls to lonely and isolated elderly people has been a lifeline to them, which has improved their mental health and helped them cope during these hard times of lockdown.
I've been part of the COVID befriending team since July 2020, and we kind of deal with people who are lonely and people who are isolated, and there's different types of loneliness and there's different types of isolation as well. And those who are lonely, you have people who are in a family, they've got lots of people around them, but inside they feel really, really lonely. And with COVID, what's happened is They may want to talk about what's going on, but the family doesn't want to hear because the family are absolutely fed up of COVID. So they just need somebody you could speak to because it's inflicting on their mental health. Pre-COVID, they could go to the shops, they could speak to people, but now they find that they're just locked up in their house and not able to do anything because of their vulnerability, because they're shielding. Now the age range that I deal with is from 21 all the way up to 96. And when you've got someone who's 96 who rings you on Christmas Day to ask you, how's your Christmas? That makes you realise that it's not about client, it's about friendship.
The befriending service, I've been doing it about 12 months now, if not more. I started off doing visits, which I thoroughly enjoy. But of course then COVID happened and we had to revert to phone calls. But people do really enjoy it because some of them are so lonely and never see anybody. Some of them have said to me, excuse me, you're the only person that I ever speak to, you know, which is such a shame really. Well, I had one lady who I called on one day and her stair lift was broke. She was quite upset because she struggled to get up and down the stairs. I found them up and asked if, you know, they could come as quick as they could really, because she's 89 and was struggling, you know, to get to the toilet. And they luckily sent someone down within a couple of hours. Some of the faces when they, you know, they open the door and they see you, you know, they're really, you know, they're pleased to see you because they know they're going to get an hour of, you know, chit-chatting all the time. Sometimes it's people who just keep talking and I don't say a lot really, but, you know, on the other hand then they're telling me about their families and, you know, their life, what they've done, and, you know, it's really beneficial to me. I really enjoy it and I hope it's beneficial to them as well.
My name is Wendy Angus Boval and I'm a volunteer with Walsall Black Sisters Collective. I've been a volunteer with them now for nearly 3 years. The area that I've been mainly involved in is the day centre element of the project, and it provides a weekly service for elders in Walsall. And for the time that it's been open during the COVID pandemic, it has provided a much needed, a much valued resource and support for our elders in Walsall. They are some of the most socially excluded and isolated members of our community, and without the support of the Survival Project, namely the Day Centre, they would have gone weeks and weeks, months and months without seeing another individual. So at least for the time that the centre was open, when they attended, they are guaranteed a hot meal, guaranteed support of the staff, guaranteed social interaction with their friends and other individuals in a similar situation, but also guaranteed outreach support should they need it. I do believe without this service, a number of our service users would have felt more isolated than they already are. There would have been a real risk and impact to their mental health and well-being. I think the day centre element has contributed significantly to the overall success of the project achieving its aims and objectives, but I take particular pride in being able to support our elders in this practical and social way.
Here at Black Sisters we provide a hot meal service, and the hot meal service is a way to cater to those in the community, especially the Afro-Caribbean. You know, we do a variety of food from mutton and rice, ackee and saltfish, salmon, stewed chicken, quite a lot of things, and it's a way of benefiting those who maybe can't get out and about, who are isolated by themselves, who maybe don't want to cook dinner on a Friday. So it's our way of showing that we do care and we do support them with hot meals. The response that we've had, everyone's very grateful, everyone's happy, the food tastes really, really nice, and you know, we keep it going each week. It's our way of showing we are still about, even though we do have lockdown, we do have COVID, it's our way of showing that we do care as a service and we are catering for their needs.
My name's Keith Ashburn. I was referred to Walsall Black Sisters by Dr. Paxton Hospital about 15 years ago. Over the last 2 years I've been doing volunteering. I look after the food parcels, on Wednesday, and I find it very challenging and everything all that. Also, on a Thursday, I look after the clients as well. It's really good with my mental health, everything, and it helps me. Maureen here give me a good role to focus my skills. Also, I like to put something back into the system that's helped me.
I lead on the counselling project here at Walsall Black Sisters. What will normally happen is I will receive a referral form from Maureen and I will book an appointment for that individual. We would meet and we would go through the contract and other paperwork such as the assessment form. The assessment form is quite crucial because that gives me an indication as to why this person has come for counselling. And it will give us an opportunity to have a starting point for our work together. The common themes that I find people are coming with for counselling are things like isolation, feeling lonely, depression, anxiety, just that feeling of not feeling hopeful, not feeling optimistic. We work together within their framework of reference. We're looking at what it is that's going on for them in their life that's helping them to feel this way. So sometimes it might be that we need to reintroduce certain activities into their life. So I help people to think differently about life as it is. I work with individuals on a face-to-face basis, telephone and online, normally Zoom. What I've noticed though over the time is that I've had some really positive outcomes with individuals and couples. You know, they come initially feeling a bit, low, not very hopeful, and I find that they are leaving me feeling more optimistic, have a sense of purpose, less anxious, I've been really encouraged by the outcomes that I've seen, the positive outcomes that I've seen with individuals and couples, and I want to continue my work within the community.
In this section, we want to remember those in our community who are no longer with us, who passed away during the pandemic, and this will be accompanied by a song by Aston Performing Arts Academy.
On an aeroplane, you can reach me with your mind. Across Walsall, as we continue to live with the effects of COVID-19, I have seen phenomenal efforts on behalf of our communities. Individual acts of kindness, collective acts of kindness, but more importantly, that ability to share and be responsible for helping those in need across Walsall. Organisations like Walsall Black Sisters have done great work in Walsall South, so I want to pay tribute and give my thanks to all of you across our communities in Walsall for the part that you've played in supporting some of our most vulnerable residents.
I would like to take the opportunity to thank Black Sisters for the support they have given to Nehemiah Court residents who have been shielding over these last few months. Also for those residents who have got disabilities. The food parcels were well received. They all say a big thank you from us to you. Thank you for your support.
Hi, I'm a volunteer from Siva Day, which is a national charity, and we're so pleased to be helping the Walsall Black Sisters in donating food for them to enable them to distribute that food that's been donated to people in their community and anybody else who comes to them that need it. People are generally finding themselves in very challenging times at the moment, and it's difficult for people to come out and ask for that help. And my father always said the art of volunteering and understanding is if you can recognise somebody's needs without them actually speaking it. And I think the Walsall Black Sisters, along with the other communities, have recognised that in the areas and have come forward. They've actually stepped forward to fill that gap.
Tina, Monique, everybody's been very helpful, and because I've been struggling because of my medical conditions, means I can't go to the shops and with neighbours and friends have also had COVID, so it's been difficult for them to get me stuff, and then friends have been on shift work, so without your help I would really be struggling, so a very, very big thank you to you all.
Yes, I do appreciate every minute of it, my darling, and it's very helpful to me as well. I'm very grateful for it.
Our COVID Survival Project would not have been possible without our funders who provided grants and donations during this pandemic. To the National Lottery Community Fund, to Charities Aid Foundation, Baron Davenport Charity, to Heart of England Community Foundation, West Midlands Police and Walsall Council. Also to our donors who provided food each week to replenish our food bank. To Tesco's, to Asda, to Suvaday, to Ahmadiyya Muslim Women's Association, we thank you. Also to Bethel Lighthouse, who allowed us to use their facilities to provide hot meals on a weekly basis. We're not sure how long this pandemic is going to be around for in regards to the restrictions, but we do know that people's lives have been affected. Many people have lost loved ones, and we know the after effects will be with us for a very long time. But Walsall Black Sisters is committed to provide community services to help address need and to help our community and to ensure that we get through this together.